Susan Brown at the Center for Better Bones. I've got the Susan's 3 for this week. There's an amazing amount of research going on. And the first article I'm going to talk about is a study that was published in JAMA, one of the major medical journals, and it entitled Mindful-Based Stress Reduction versus these antidepressants for adults with anxiety disorders. So they were looking at anxiety, and essentially they compared a drug, an antidepressant drug, Lexapro, to a meditation course where people practice meditation over 24 weeks. And you know what they found out? They found out that the meditation was as effective as the antidepressant, and it only had good side effects. So there you go. We've been promoting meditation. We've been promoting the value of quieting the mind. Extremely important for meditation. So find yourself a good meditation course. If you have nothing, if you don't have anything at hand, I've developed a little CD, a DVD with meditations for bone health, kind of quieting the mind and focusing the energy on bone health. Meditation shown to be as effective as antidepressants. The second study I thought was really interesting was a study on weight loss in older women and its relation to bone loss and hip fracture risk. Now, I've been saying this for a long time. If you followed my work, I've been saying that after you're into menopause, losing weight is associated with bone loss. When you lose weight, you lose bone. I always tell people to be very careful about weight loss as we get older, and because you're going to lose bone. It's possible there's ways to avoid that. I can talk about those later, but this is another piece of research showing, in fact, that if you lose weight, and they found that it's 5%, if a person lost 5% of their body mass, their weight, that was considered weight loss. People who'd lose weight, people who are stable, and people who gained weight. And what they found in this study is that people who actually gained weight had the least amount of bone loss as they aged. You know, the average person might be losing, we say, after menopause by 60, like 0.5% or 1% a year. Well, in this case, the people who gained a little bit of weight, they lost only 0.5% a year. And the people who had stable weight, they also lost a little bit more than the people who gained weight. And the women in the weight loss group that lost more than 5% of their body weight lost about 1% a year. So in other words, the bone loss was very highly related to the weight loss. People who lost weight lost bone, and people who gained weight tend to gain bone. You know, some of you probably know I'm an anthropologist, and I love those Paleolithic figurines of these older women that were very rotund, very big. And there is certainly advantage to having, as my grandmother would say, a little meat on the bones. And as we age, there's a natural tendency to eat less. It can be very easy to lose weight, but it's not a good idea. And they looked at hip fracture. Well, what happens as the women lose weight? What happens to the hip fracture risk? And they found that the women in the weight loss group, and this was only losing 5% of your weight. If you weigh 100, you're talking about losing 5 pounds. If you weigh 150, you're talking about losing like 7 pounds. Makes a really big difference. Women in the weight loss group had nearly twice the rate of hip fractures as those women who were either stable or increasing in weight. So if you're thinking about hip fractures, pay attention to weight. Don't get caught up into this thing. It's better to be thin. Thin is lovely. It's not good for your bone, and it's not good for you. We want to have high quality diets, high quality fats, carbohydrates, nuts, and seeds that keep our energy up. It's easy to eat less as we get older because our appetite decreases, but it's not a good idea to lose weight. The last one I thought was really interesting is published in Neurology, a very well-known journal, and it's about the association of red blood cell omega-3 fats with markers of cognitive function in midlife. And this was the Framingham Heart Study, a very big study going on for decades. And you remember that here at the Center for Better Bones, we really champion omega-3 fats because they are a kind of fat that we evolved on a lot of, and they're very, very important for protection of every cell. They're important for anti-inflammatories. They're important for cognitive function in young children as well as in older people. And sure enough, now that we can measure omega-3 fats, and we here actually have a little simple omega-3 test kit that you can purchase at the Center for Better Bones, you can see your level of omega-3 fats. People with a higher level of omega-3 fats, these older people, had a better brain structure and cognitive function. Amongst these middle-aged individuals who had no dementia, they had much better cognitive functioning if their omega-3 fats were higher. That's EPA and DHA. That's the kind of fats you get in our Mighty Omega, which is anchovy from Chile, actually a very high quality EPA and DHA. So those fats help to stabilize and enhance many different aspects of the brain. And this study actually details all the different parts of the brain function they mentioned in their study. And you can look at this study up if you want, but the idea is the higher omega-3 fats, the better cognitive functioning. So may we all stay alert and helpful for a long, long time. If you like what we're talking about, if you want to know what my tips are, my research that I review every week, you can always subscribe to tribe.drsusanbrownphd.com. That's tribe.drsusanbrownphd.com. We have an ongoing tribe where people share information, people communicate with one another, jump on the tribe, and we will keep you informed. Have a great day.